Hi, I'm Hugerta Deliai from Electrical Engineering Department of Eugenio Maria de Jesus Community College of the City University of New York. It is the 20th of May 2020 and I'm going to present some general information of what is currently known as the coronavirus disease or COVID-19 pandemic outbreak. We should be aware that this is a new virus, and what is known about the virus now might change in the future. I want to go over the origin of COVID-19, the virus global infection development as a pandemic disease, some of the symptoms, treatments, and prevention techniques related to the novel coronavirus. In December 2019, China reported to the World Health Organization cases of pneumonia in Wuhan province. The pneumonia was caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, and infection is called as the coronavirus disease 2019 or COVID-19. In the map, we can see the actual global spread of the coronavirus. The spread of infection is transmitted usually from person to person through droplets suspended in the air when an infected person sneezes or talks, or from surfaces of objects that has been contaminated prior with the virus. The reproductive number or the average number of secondary cases a primary case can infect is estimated around 3. Therefore, the disease started spreading quickly from China to the other parts of the world, and on 12th of March 2020, the World Health Organization characterized COVID-19 as a pandemic. As of 30th of May 2020, there have been more than 4 million confirmed cases and 287,525 deaths in 215 countries across the world, with an increasing number reported daily. In the map, the bubble size indicates the number of cases. The larger the size of the bubble, the higher the number of the infection represented. As we can see, the biggest bubble is in the United States, when the number of the confirmed cases is around 1/3 of the total cases. Now I'm going to talk how does the disease is presented. People most at risk of infection from the novel coronavirus are those who are caring for people infected with the virus, such as family members or healthcare workers. From what is known so far, there can be a number of symptoms ranging from mild to severe. Symptoms like fever, coughing, and shortness of breath, and in more severe cases can be pneumonia, kidney failure, and in extreme cases, and death. The great news is that the majority of cases, around 80% of COVID-19 infections, result in mild symptoms, 15% in moderate, and only 5% in severe symptoms requiring intensive care. There are certain groups that are more at risk for developing severe symptoms, and that's especially those who are over 4 years old or those having chronic disease such as diabetes, hypertension, coronary artery disease, chronic pulmonary disease, or cancer. The infection can be diagnosed by a test called PCR or polymerase chain reaction. This test identifies the virus based on its genetic fingerprints. There is currently no vaccine or medication for the virus that has been approved by the Food and Drug Administration. gone through controlled studies that demonstrates an effect on the virus. Treatments and vaccines continue to be in development. This is an illustration of steps to help prevent the spread of the virus. The strongest and most effective solution that society has against this virus is to avoid being exposed to the virus. Preventive measures are the current strategy to limit the increasing number of cases. People can reduce their chances of being infected or spreading the COVID-19 by frequently washing their hands for about 20 seconds or using portable hand sanitizer and avoiding contact with their face and mouth after interacting with possibly contaminated environment. High-touch areas or surfaces should be disinfected daily with regular household disinfectant containing a diluted bleach solution or 70% ethanol. The risk of transmission in the community can be reduced by covering the mouth and nose with flexed elbow or tissue when coughing or sneezing. Avoiding crowds and close contacts with ill individuals. Many countries have installed quarantine and social distancing as measures to prevent the further spread of the virus. Together, we can help stop the spread of the virus by staying home and staying safe. So, this was my short informative presentation about coronavirus pandemic, and there is my contact information. Thank you for your time.